We'd like to introduce, it's called Expanding Whole Person Culturally Grounded Care, presented by Dr. China Bolden, Jarvis, Anna Duncan, and Makinie, Fortino. Let's go over who these people are. Dr. China Bolden Jarvis is a clinical psychology postdoctoral fellow whose work focuses on expanding access to evidence-based mental health care for underserved youth and families. She earned her doctorate from Seattle Pacific University and completed her predoctoral internship at the University of Washington School of Medicine. Her clinical and research interests center on community-driven approaches to address youth, suicide, trauma, and self-harm, with a strong commitment to empowering communities to lead solutions to the mental health crisis. Anna Duncan. She currently serves as a program and policy lead at CoLab for Community and Behavioral Health Policy, located within the UW School of Medicine. Anna leads policy efforts to strengthen the publicly funded children's mental health system in Washington, with a particular focus on expanding the community-based workforce to create more equitable, responsive, and accessible care for populations facing the highest barriers. Anna received a Master of Public Health in 2024 from Johns Hopkins Bloomberg School of Public Health, where she served as a Bloomberg American Health Initiative Fellow, focusing on adolescent health. Prior to working at CoLab, Anna served as an advocate for survivors of domestic violence and their children in King County, Washington. Makinie Fortino is a founder and president of DMHS, Deconstructing the Mental Health System, Inc., a pioneering initiative focused on addressing racial and financial inequities in mental health care. A licensed marriage and family therapist with over 10 years of experience, Makinie has worked across multiple roles in mental health and social services in Connecticut, Florida, and Washington. She holds a master's degree in marriage and family therapy from Central Connecticut State University, and in 2020, she founded Deconstructing the Mental Health System to bring together anti-racist practitioners to promote culturally relevant and equitable care for communities of color. She is also the author of Treating Black Mental Health with an African American Caribbean Spiritual Lens and Spiritual Therapy, Evidence-Based and Effective Interventions. Welcome. We look forward to your speech.
Good afternoon, everyone. This is such an unexpected treat. I will say I was really looking forward to this, and there's so many faces that I did not expect to see, and just so many wonderful ideas flowing, and it's just so nice to be in a space with like-minded folks working on a really big problem. So I'm really excited to be here. I'm here to introduce some exciting work that we have been doing at CoLab for Community and Behavioral Health Policy at UW, alongside other community members that you'll get to see shortly. Our partners and I have been deeply engaged in this work related to well-being specialists. So as many of you have highlighted so far in our program today, we're facing a mental health crisis in Washington state, and not just because of rising numbers and increased acuity, but because we don't have enough providers to meet the current need. And what this translates for many people that I've talked to in our community is, sorry for your troubles, but we can't help you. And this is an equity problem. And the communities feeling this the most acutely are our low-income neighborhoods, rural areas, and communities of color. And for many Washingtonians, especially those who have been historically marginalized, access to mental health care is not only delayed or denied, it's just simply not available. But the truth that we don't always acknowledge or say out loud is that healing and care are already happening in some of these communities. And people in our community, such as parents and caregivers, elders, faith leaders, peer mentors, and even my kid's gym teacher, are doing the work of listening, of holding, and guiding individuals on a path to mental wellness. These folks are showing up for one another in culturally grounded ways without formal training, without access to the resources that folks like me and my colleagues at Seattle Children's have, and they're certainly doing this without pay. This is not equitable, and it's not sustainable. What if we stopped seeing these folks as barriers, better yet, started seeing them at all, seeing them as essential contributors and a bridge to better health? And in this moment, I'm pretty excited. We have a cool opportunity to reimagine what mental health care workforce looks like, a workforce that we need in order to meet the current demand. This means building pipelines and pathways that are inclusive, supporting training models that are flexible, community-based, and culturally grounded. And it means honoring the wisdom that already exists by elevating community members as vital partners in care. And this is what we've aimed to do at CoLab with the CARE Project. And my colleague Anna is going to guide us through what some of this has looked like so far.
All right, thank you so much, China. As already mentioned, my name is Anna Duncan, and I'm the Program and Policy Lead here at UW CoLab for Community and Behavioral Health Policy. And I'm excited today to share a bit more about the CARE Project and one of its key outcomes, the Wellbeing Specialist role. So the CARE Project, which stands for Culturally Affirming and Responsive Mental Health Care for Kids and Families, officially launched in 2022 with generous funding from the Washington State Legislature. Its ultimate goal is to promote culturally responsive behavioral health care while centering people with lived experience in the behavioral health system. So the CARE Project has a unique structure. It's facilitated by UW CoLab, but it's led by a coalition of over 100 community partners from across Washington State. Over the past 3 years, this coalition has used a layered, community-centered co-design process to develop solutions from the ground up. Through advisory groups, a statewide sounding board, surveys, coalition meetings, and subcommittees, CARE has worked to create multiple avenues for people to engage, ensuring that this really was community-owned and community-led. So one of the key solutions to emerge from this co-design process is a new community-based workforce role called the Wellbeing Specialist. So what is the Wellbeing Specialist? A Wellbeing Specialist is a community-based provider who does not need a clinical degree or higher education to provide supportive care. They work alongside licensed mental health providers, bringing lived experience and cultural knowledge that reflects the communities they serve. The Wellbeing Specialist operates under what we call an expanded philosophy of care, one that centers wellness, not just illness, which I've heard is a recurring theme in today's discussions. This means they provide therapeutic services that include group-based interventions, art, storytelling, cultural practices, and spiritual healing methods grounded in community traditions. And it's important to note that the Wellbeing Specialist is not a new Department of Health credential. Rather, we imagine it as a role that builds on existing, already Medicaid billable workforce designations, such as agency-affiliated counselors, community health workers, and certified peer specialists. So, while we envision multiple pathways for implementing the Wellbeing Specialist role, we've identified the registered agency-affiliated counselor credential as a strong starting point. It's Medicaid reimbursable, it doesn't require a clinical degree, and it's already integrated into the public behavioral health system. So next, I'm going to briefly walk you through an example of how a Wellbeing Specialist might get hired and trained in our current system. So first, an individual would be hired by a state-licensed behavioral health agency as a registered agency-affiliated counselor. Next, they would receive on-the-job training and well-being competencies, which are grounded in cultural and relational care. Then these competencies would be verified by their host agency, and then they would be able to go on to bill Medicaid under the mental health care provider designation. And lastly, the Wellbeing Specialist could then go on to practice under the supervision of a licensed mental health provider by their employing agency and can bill Medicaid for a wide range of what we're calling well-being services. So moving forward, the CARE Project team will be releasing a Wellbeing Specialist blueprint this June, which includes operational details about recruiting, hiring, training, and reimbursing for the Wellbeing Specialist role. We're also looking to begin local partnerships for piloting and implementation. So our vision, which I would imagine is a shared one in this room, is that all children, youth, and families in Washington can have access to care when they need it, care that reflects their culture and their lived experiences, and care that promotes a broader culture of individual and community wellness. So as I mentioned previously, the CARE project is a unique coalition of over 100 partners, and from the start has been community-led, community-imagined, community-developed. And so in reflection of that, you will next hear from a number of our incredible CARE partners, many of whom are in the audience today, speaking to the value of this role, of their work, and their involvement in the initiative. Okay. Oh no. There might be a brief technical. Okay. I'm not sure how to press play on here. Oh, there we
Hello,
go.
my name is Martha Ortiz, and I'm a certified peer specialist at Seattle Children's Hospital, where I work in the high acuity program supporting parents of children with disruptive behavior and other diagnoses. I've also worked for the Calma Clinic, which serves Spanish-speaking families, helping them navigate the mental health system in their language and within their cultural context. Across all of my roles, I help parents not only understand the systems they're in, but walk through them with more clarity, more confidence, and more hope. I often do that by offering my own lived experience as proof that healing and change are possible. I'm also a consultant with the Co-Lab Care Project and one of the co-creators of a parent wellness curriculum rooted in validation. Through CARE, I've helped shape the vision of the well-being specialist, a role that reflects the heart of peer work while creating new professional pathways for lived experience to thrive. What resonates most with me about the well-being specialist is how deeply it reflects the values we hold as peers: lived experience, system navigation, emotional presence, wellness, and hope. This role takes those values and builds a structure around them, one that allows us to reach more families with intention, skill, and lasting impact. I chose validation as the foundation of the curriculum because of my own parenting journey. My daughter showed signs of anxiety from a very young age, and I didn't have the tools or support I needed. And by her teen years, her mental health and our relationship were both struggling. When I learned about validation and began practicing it at home, everything shifted. Our connection rebuilt, and her mental health significantly improved. I knew I had to share that transformation with other families by helping translate theoretical concepts into practical, real-world guidance rooted in lived experience. That's what the well-being specialist can offer: the ability to turn personal growth into meaningful, healing relationships for others. My vision is for this role to be recognized, invested in, and expanded, not as an extra layer, but as a vital part of the mental health system. There are so many people who have walked through fire and come out with wisdom, strength, and a deep desire to help others. With the right structure and support, they can become the backbone of a workforce that brings real change, one relationship at a time. Families deserve this kind of support, and the well-being specialist role gives us the opportunity to meet that need clearly, compassionately, and powerfully. Thank you.
Hi, my name is Carolyn Cox. I'm the Executive Director for the Spark Peer Learning Center. And we are an organization that is a consulting and training organization for peers in Washington State. Our mission is to support young people coming out of high school or maybe even from college, wanting to maybe learn how their lived experience can support another person. And so we train and consult with other organizations on how to bring peers into the workforce and provide them the training that they need to get started. So what resonates with me and why Spark was brought into this project was to help bring in youth voice into this project and look at where youth can have a say in their communities in what services should look like and how they should be delivered. and definitely bringing in the culture aspect, the spirituality aspect, and other different variations of community. We feel very inspired moving forward that the wellness credential is just going to broaden the scope of work that peers or healthcare workers can do in this state, because there is so much more that we can do and bring to a community than most people think. And so this project has been for us to be able to have a voice in how things are how things are going and where things are going in communities, because communities know themselves best. And so taking this work and moving it forward is very important to Spark. And we enjoy our work with CoLab very much.
Hello, everyone. I am Shayla Collins. I work at the University of Washington Center for Child and Family Well-Being, the University of Washington CoLab, and the University of Washington Institute for Human Development and Disabilities as a part of the Washington State Medical Home Project. My role on the CARE project has been that I have been a part of the culturally responsive curriculum team, as well as the well-being specialist committee, both of which I had a beautiful time and absolutely love. Today, I'm going to talk about the importance of the well-being specialist within the mental health care space. As a parent of two now teenagers, I wish I would have had more mental health support when they were little. Looking back on my experience, I realized that I didn't feel like I was their mom until they were about 10 years old. What I felt like the entire time was a project manager. Both of my sons were born with disabilities, so managing all of their health care and their specialists, as well as their educational needs, and navigating the social service system was beyond daunting and took a toll on me, mentally and physically. I wish no family to have to experience that. And with the well-being specialist role, families will have the support that they need to thrive. And not only is that beneficial for the families and the children, it's beneficial for our communities as a whole. So I ask today that you invest your time, your knowledge, as well as your dollars to families who need the support in order for us all to be at our best. Thank you.
Thank you, Shayla. My name is Makinie Fortino. I'm a licensed marriage and family therapist, and I'm the CEO of Deconstructing the Mental Health System. Deconstructing is a verb, and in the context of mental health, it means to learn and to teach that the socioeconomic barriers and health disparities that people of color experience are due in part to the direct, complicit involvement from mental health providers who committed harms such as experimentation without consent and misdiagnosis and much more, dating back to slavery. We sought to address this as a collective in 2020 in forming DMHS, and our mission is to connect communities of color to high-quality providers of color. And we do that in 4 ways. The first way is through our directory, and we have over 450 providers of the global majority available to communities seeking help. The second way is through our resources and workshops, and we also advertise for our partners for free. The third way is through the DMHS free therapy and wellness program that we offer. We have contracted with over 44 providers of color, representing 7 ethnicities, providing services in 4 languages, and so far, we're in 8 states. And the fourth way is through continuing education opportunities that we provide to providers of color with the intention of retention. And that's why we were so excited to have been selected by CARE to provide and pilot the culturally responsive care training. I was the coordinator for this project, and we had two amazing trainers, Dr. Shalon Irvin and Taquisha Dean, licensed associate therapists. And this training centers the experiences of communities of color with the intention of improving community mental health care. Our dream is to be able to provide this training to well-being specialists who will live in the communities that they serve. And we're hoping that they'll work with community mental health so that when youth and families of color take that really big step of asking for help, they not only feel safe, but they feel welcome. And now, it's my pleasure to introduce the next speaker, Deacon Jones, the CEO of New Developed Nations, who was a core partner of the CARE project and was one of the inspirations for the well-being specialist model.
I'm Deacon Jones, originally from Lapwai, Idaho. I'm a Nez Perce tribal member, and I'm a father and the CEO and founder of New Developed Nations. Growing up in Lapwai on the res, there wasn't a huge hip-hop influence, but it was there in pockets. Being a little kid, listening to hip-hop and kind of understanding a lot of the stories they were saying, because there is a parallel between where those artists were coming from and where I came from on the reservation. So once I started working with youth, I had a question that I often ask myself, are they gonna be able to use music the same way that I was able to? Because it kind of kept me feeling free. And so when I got the opportunity to try it with a group of kids, and I saw right off the bat they had disclosures, that's when I understood that a program like this needs to exist and it needs to be studied and researched more. So after doing a lot of my own research and development, the neuroscience behind the addictive brain and the music brain and how new neural pathways can be formed, I put into practice making music intentionally that would form new neural pathways in your brain. After some years of running the program, we got to New Developed Nations, which now we have a multidisciplinary team of certified peer counselors, care coordinators, community health workers, and a mental health therapist. So after studying some of the cases, going through some of our success rates and the numbers and all the data that we've worked over the years, we worked with University of Washington to make healing through hip hop an evidence-based practice. This is something that is rare, and being able to bring culture into evidence-based spaces is the biggest win of all. And being able to have our youth come through our program and see the representation that they see from their staff, and to be able to participate in hip hop and art and meditation and yoga and things that we haven't had readily available to us is one of the biggest wins that we have as well. So that was something that was really important for us to be able to create in this space. You don't have to want to make music to come to New Developed Nations. You can have the want to just have a therapeutic team that represents the culture that you come from, and we'd be a great fit for you.
All right, so thank you to everyone who shared and for giving us such a meaningful picture of why this work matters. To close us out, I'm just going to share a few ways that you can get involved in our project. So first, right now, we're looking for regional partners interested in piloting the wellbeing specialist role in their communities. We also welcome advocates who can help us bring this approach to state decision makers and just support broader policy efforts. And lastly, we're seeking funders who want to help scale and sustain this work over time. So if you're interested in any of these roles, we would love to connect with you. And one last note. I want to just end today's presentation by thanking all of our community partners, our coalition members, and agency collaborators who've truly shaped this work every step of the way. And a special thank you to Chad's Legacy Project and to the Washington State Mental Health Summit for this incredible opportunity. The Wellbeing Specialist is truly a community-driven solution, and we're excited about what's ahead. So thank you so much. And I have no idea our time, so I'm not sure if we have time for Q&A.
Well, I think we have time for one question. So here's a question from someone online asking about, given the current administration stance against DEI and diversity programs and initiatives, how do we get your funding protected from cuts?
Very important question. Do either of you have any thoughts, or do you want me to take it? You want me to? Okay. That is a great question. I think there's a lot of, obviously this is very much on our minds. It's a very timely question, and I think there is an element of not fully knowing how our funding will roll out. I think that is one reason why we've really approached this through Medicaid. Again, we know that there are even threats to Medicaid funding as well right now, but the hope is that by utilizing existing payment pathways through existing provider structures, there is some protection around workforce roles and around workforce reimbursement. That is, and as I mentioned before, I think there's a hope to eventually expand this out to more community-based providers like community health workers, working in community-based organizations or other settings. And I think for this initial pilot, we're really approaching it from kind of the lowest hanging fruit around an easier pathway for billing, with the hope that that can sustain this role. So I hope that answers your question. All right.
Thank you so much. You know, I will just tell you, as a longtime reporter here for many years and then going into this business, I don't even think 10 years ago we'd be talking about something like this. So just really grateful that we are moving forward, that people are still carrying it and still going to go forward, but very grateful for that. Just as a reminder that this is kind of relatively new, believe it or not. Thank you so much for that presentation.